welcome to XReality podcast. I'm the host, Dominic Wu, and joining me today is Dr. Linda Ciavarelli. Dr. Ciavarelli is a doctor of podiatric medicine and the ABMSP board certified specialist in primary podiatric care. With over 20 years of clinical experience ranging from community care in private practice to facility-based care, she has honed her expertise in preventive, orthopedic, and dermatologic podiatric medicine. Hi, Dr. Linda. Um, could you share a little bit about your background with us?
Yes. Hi. Thank you, Dominique, so much for having me on your podcast. It's an honor to be here, and I really appreciate you having me. A little bit about my background. Like you said, I've been a podiatrist for over, it's been just 20 years. I've had the honor to serve my community in the practice of podiatric care. And so for those of you out there who aren't really sure what that means I'm a foot doctor. And so that means that my practice is around the treatment and prevention of disease in the foot. And so that doesn't just mean things that arise in the foot, like ingrown toenails and skin disease, but also more impactful diseases like diabetes in particular that can have really significant effects on the foot that can have significant outcomes for patients. Thank you so much for having me. I'm really excited to be on the podcast and talk a little bit about this. I'm going to assume I'm probably the first podiatrist to be on your show.
Yes, yes. This word I've been practicing like 30 minutes before the podcast. I need to make sure I remember this word. Um, yeah. Yeah. Can you describe a little bit about your patient? Because as far as I know, you mentioned diabetes and also ACL, like a athletic athletes, like the food injury. So those so how serious if a person got like some like a disease and why should we care about this area?
Yeah, podiatry is a really interesting specialty because we're an anatomic specialty. So, like dentistry or like ophthalmology, we're not a system based. We're not like a neurologist that deals with all the nerves in the body. We deal with one part of the body. So we see, as a podiatrist, I treat from patients from cradle to grave. So from, very young kids all the way through very, very, very old people. In my personal practice, I tend to skew towards older folks. That's just my personal preference, sort of where I am, but our profession certainly treats all ranges. Primarily, again, in my personal practice, what I typically tend to see, I tend to do a lot of preventative care. And, of course, I do see people with athletic injuries. I see sort of, a lot of ingrown toenails and dermatologic issues, skin rashes. And, I won't bore you with all of that stuff and toenail issues. But primarily, I would say maybe 60 to 70% of my patients have either significant circulation issues or have diabetes. So diabetes is a very, very common thing in the United States, worldwide, found effects on the lower extremities on the feet of people. The reason why it's really important is because without preventative care, you're at much higher risk. A person who has diabetes has a much higher risk of developing complications. So, for
Oh,
example, a person with diabetes, if they have a blister or a sore on their foot, they have a much higher risk of developing an infection. That infection has a much higher risk of not healing. That wound has a much higher risk of eventually ending up in some sort of an amputation. So, I tell my patients who have diabetes, because their sugar is a little higher, their blood is like honey. And so if
Oh,
there's more honey around, it's harder, the bacteria love it. They get in
oh,
there, they can make all kinds of trouble. It's harder for the body to bring all the healing the healing cells in there, and that can cause problems down the road. Another problem that can happen with people who have diabetes is they can develop something called neuropathy. And that's where they can't feel their feet well. And so you might say, well, what do I care if I can feel my feet or not? But, if you step on something and you cut yourself, you need to know that that's a
oh,
problem. And if you don't, then you can get a cut and an infection and all of those problems. So,
mm,
so from my perspective, that's just a very high level what it is that I do and what my practice looks like on a day-to-day basis and the kind of thing that I'm always educating my patients about. And really what brought me to working in XR is that I really noticed how many of my patients oftentimes would have had diabetes or maybe a circulation issue or some
mm,
other, maybe a dermatologic issue like a skin problem. And they didn't really understand what was happening with their disease. And so I would kind of say, well, hey, do you know anything about your diabetes? And they would say, no, I don't really know. And I would explain it to them in a way that I thought was helpful. And
mm.
many times people would say, wow, well, nobody ever explained it to me like that. And I thought,
Oh,
why is that?
mm,
Why is it that it's this person maybe has had diabetes or whatever for 20 years
mm,
and nobody, and it's not because people haven't tried.
mm.
It's just people weren't able to explain it to them in a way that they understood. And
Yeah.
and that was just a real problem, like over and over. They just didn't understand the basic tenets of their disease. And
Hmm.
so how could I ask someone, like, oh, I have these, 10 things I need you to do,
Yeah.
but why?
Yeah.
Why am I asking you all of this stuff? And on the other end, Dominique, the realities of healthcare today is
Mm,
there's so many more patients and so fewer providers
yeah.
that, there's just more and more and more and more. And I have less and less and less time
Mm.
to have those really critical conversations. So that's really
Oh.
what that was the spark
Mm.
for me around immersive technology. I thought, well, why can't we use this great medium,
Yeah,
right?
right.
This sort of great way to explain things, right? Like
Yeah.
you immerse someone in something. Why
Yeah.
can't we use this to explain what I'm trying to explain to my patient? And that was the genesis for HouseCall VR.
Oh, wow. So, yeah, I think that's totally makes sense. And prevention is more important than cure, right? If we can prevent, we don't need to suffer all those things. And in order for people to do what prevention need to do, it requires education. And VR is the best, I would say, one of the best or the best medium to do the storytelling. Right.
Yes.
So, especially, for example, if you can create something that as simple as like a 5-year-old can understand. For example, you just mentioned like, oh, your blood is as sweet as honey. I mean, I understand. But if some other doctor, they will put a lot of data and use a lot of words that I have no idea what's going on. And I would like, why should I care about those numbers, right? And usually, I remember every time when I go to the hospital, doctor will say, "Oh, those are red. Those numbers are red. It's dangerous." Because I am anemic, so a lot of blood. It's like a lot of red. I don't really know what's going on. As far as I know, my red blood cells is smaller compared with other people. And also the hole to carry oxygen is a little shallower. It's like not deep enough. So there are not many oxygen. So imagine if this can be visualized in VR, then I know, well,
Exactly.
the sheep, right? The sheep is smaller, and the seat, there are not many seat to carry some, oxygen staff. I don't know how to visualize those, but yeah. So I totally agree with that. If we can visualize and tell a better story, then patient might understand very quickly and immediately do whatever to prevent them to get more serious. Yeah.
Yes. Yeah. Yeah.
Yeah.
You hit it on the nail on the head, Dominique, that, the term that's used in healthcare around that is health literacy. So, and what health literacy, I think when people hear the term literacy, they might think, like reading literacy, like the
Mm,
ability to read language. But what we're talking about, when you talk about health literacy, you're really talking about the ability to understand,
mm,
interpret,
mm.
and act
Yeah.
on your health information.
Yeah.
And so, like that example that you gave is so important because, you're a doctor just pointing out red numbers to
Yes,
you
and said that, oh, you need
and
IRA.
said that's bad. I mean, that's okay, that's important that you know that, but like you're not given the information to understand, like you don't understand that, much
Yeah.
less can you interpret that or act on it.
Yeah.
And so, that's a critical sort of failure in healthcare today. And,
Mm,
health literacy has been really neglected. There's some
mm.
estimates that show that low health literacy costs the American healthcare system something like $230 billion
Oh, mm,
annually.
wow.
And the solution, Dominique, is a
Hmm.
brochure.
Oh, who will read
It.
for sure?
Or Dr. Internet or Dr. GPT now. Right?
Oh,
Like so that's our solution. Or Doctor Do Better, right?
oh,
You know, Doctor Do Better and also Doctor See More Patients,
yeah.
right? And so and also, it's an insane proposition. So, why not apply a technology
Mm.
like immersive technology that is, just like you said, superior at storytelling,
Yeah, right.
that's scalable,
Yeah.
that's standardizable,
Mm-hmm.
right?
Mm.
There's very little standardization in health, in patient education across the board. I
Yeah.
mean, that's not really, like, it might be institution to institution, but it's not really standardized what people learn anyway. What your doctor says
Mm,
about this or that, or it varies, right?
mm,
Then you can think about it can be measurable,
mm.
and then it can be personalized.
Oh,
So why not take all of that technology and put that towards that $230 billion
mm,
annual problem
yeah.
as a first step
Mm,
before you start asking patients, before you can even ask them to change behavior, to take a medication, to do
mm,
all of these other things. People want to know. We live in the
mm.
information age. People want
Yeah.
to know. The days of going to the doctor, getting a paper and going, I don't know, the doctor just said do the thing.
Yeah.
Like that's less and less. People want to know and deserve to know, and frankly need to know what's
Yeah.
going on. And the research bears out that people who are patients that are better informed, that are better engaged, have better outcomes. And we know that, but still the solution is a brochure. It's mind-boggling.
Wow. Yeah, and brochure has a lot of professional terms that doesn't really help people. And I remember every time when I went to the hospital, I always need to ask, like, I usually say, sorry about this stupid question. What's benign tumor? Something like that. And I need to Google and then do the Wikipedia and read everything. And before I respond to the doctor, and also yeah, like a lot of things I have to have my phone ready, and every time when there's a professional turn, I usually say, wait a second, I need to type into the Google and make sure that I understand before the conversation keep going. Yeah, so that's how I do. So I believe a lot of people might struggling understand all those like terms, and also feel like a little bit distance or not really fully understand what to do, or just follow, but without knowing why. Yeah.
Yeah. Yeah. And you bring up a great point that the print medium, it actually leaves out quite a few people. You're forgetting people who won't read it or can't read it,
Yeah,
and that a lot of content inadvertently is developed that's not understandable for people.
yeah,
And even if it's written and then if it's spoken, technical terms are
yeah,
used, euphemisms are used. This
yeah,
will be uncomfortable. This is
yeah,
benign.
yeah,
Like these
yeah.
words, these
Benign, you
terms
can
that,
just say good tumor.
yeah, yeah, yeah. You can say
Yeah,
you're okay. You
you're
know,
okay.
I mean, the test is negative. That's a good thing. The test is positive. I mean,
Yeah.
maybe you get right. Like, so, it's that dissonance. And so using an immersive experience that transcends all of that, that
Mm,
can be that can be customized to language,
mm,
that doesn't require reading fluency,
yeah.
that is and then has all the added benefits of being standardized and immersive, have the increased retention. And then
Mm,
on the other side, from the provider perspective,
mm,
it allows the provider to offload
mm.
that repetitive conversation,
Yeah, yeah, that's great.
right? So, like for me in my clinical practice, there are things that I'm always explaining,
Oh,
always,
yeah.
like every day to explain, doc, explain this to me. And I've got a thing and I talk about. So, and that's, and I think I'm doing good. I don't have a way to measure it. I don't have any way to get any feedback. I look at the person and
Mm,
maybe ask a question or did you understand? But, so what if I can offload that repetitive explanation onto a digital device that
mm,
can measure the outcome?
mm,
And then that allows me
mm,
to go as a provider and
mm,
work at the top of my license and do the thing that I'm really supposed to be doing, in the
mm.
patient care part, where I'm doing like the really hard work of where a provider should be doing the provider work. So it's,
Yeah.
there's that double benefit. You get better patient understanding
Yes.
and you can have that increased efficiency from the
Yeah.
provider perspective.
Oh, what does provider mean? You mean insurance provider? I don't know.
So when I say provide, no, thank you. No, thank you
Yeah,
so much.
I have no
And
idea.
right, like,
I'm
no,
from UX UI.
I'm using an industry term. So provider means any healthcare provider. So that means like we would have in the past used the term doctor for that.
Oh, mhm.
But now when I say provider, what I mean is anyone who's like actually rendering care. So that would be like a nurse practitioner or a
Oh,
nurse or anyone else, assistant, or anyone else who is doing doctor adjacent work, a dentist, not anyone else who's doing doctor or doctor adjacent work. That's what I
oh,
mean by a healthcare provider.
oh. The person who directly interacts the patient, that's the healthcare provider.
Yes.
Okay, got it. Wow. Yeah, I learned a lot. Yeah. Yeah, I mean,
Um,
my background is more
hey,
development
Dominic,
software.
I
Yeah.
think
Hmm.
my internet is giving problems. So hang on. I'm going to try to get back on my phone. Okay.
Okay, sure.
Okay, hold on. Okay. Hey, I'm
Hmm.
sorry about that.
Yeah, no worries, no worries. Yeah, yeah. So do you think like for example like for the average your patient, what do they understand? For example, like all the professional term they might not know. I know it because I understood all those like a pain disease, so I learned it. But it's very miserable to learn things on this way because you need to get through that and meeting a lot of doctors and start remember all those professional terms. If there's a kind of like an experience, right? Just like you said, the emerging technology that can solve the problem. So, You mentioned that HouseCall VR. Can you tell us a little bit about HouseCall VR?
Yeah. So that's exactly what we're doing. We're kind of, I like to say we're Magic School Bus meets WebMD. So
Well,
those
I
of you
like your turn because your turn just make everything so clear. Just like you just say something and I feel like I got it.
Okay, good. Then I'm doing my job. Then I'm, definitely doing my job. And that's it. We take people, for those of you that remember the Magic School Bus, it was a cartoon that was on TV in like the 80s and 90s. And there was this wonderful teacher who would take her kids onto a Magic School Bus and they would go out into space or deep into your cells. And it was very simple explanations of
Mm,
very complicated things. And so that's exactly what we do. We
mm,
take people inside of their body to learn very
mm,
complicated processes in
mm,
very simple and stylized ways. So we take away all the technical terms. If we do use a technical term, we define it. We're very, very careful and thoughtful about making short and understandable learning experiences. These experiences are for everyone. So I developed these for all of my patients. I use this in my clinical practice. Some of the oldest patients that I've put this on, I've had someone who's 88 put this on, and she said, of all the years I've had diabetes, I've never understood it the way I do now. So just
wow.
we've developed the first chapter in the first book of this library that we're building. We're
Mm,
building a library of immersive information about health, about procedures, and about medication. And the first chapter of the first book that we've developed is about diabetes. That's near and dear to my heart because for a couple of reasons. One, it's something that I have subject matter expertise in, obviously because of my work. Also, there's an incredible impact on people.
mm,
It's also, diabetes is one of the few places in medicine where there is a recognized framework for patient education. Most places, like what you learn from your doctor is what that doctor knows. It's
mm,
not like there's no like recognized and validated framework around
mm,
diabetes patient
mm,
education. There is. And so it was a good place to start. So what we do is we have a very simple system
mm,
that works in a clinical setting. So this is a VR headset that happens in a clinic. So we're not sending this home with patients. This happens in my clinical office. It happens right there in the exam room, typically after I'm out of the room. So if a patient has a question about diabetes,
mm,
and it's a super simple setup. We have a 30-second onboarding rule.
mm,
So from the moment the medical assistant walks in the room
mm,
until the patient is fully immersed, it's 30 seconds.
mm.
Also, there's no internet needed. And so that's
Oh, wow.
really, really critical. Most people don't know this, but hospitals have terrible Wi-Fi,
Oh,
terrible Wi-Fi.
yeah.
All of them, it's a continual issue. Talk to anyone who works in healthcare. It's a bad situation. So you can't rely on Wi-Fi. So our
Mm,
system does not rely on Wi-Fi.
mm,
And then each one of the learning modules is really short. It's a 3 to 5 minute immersive experience where you go inside your body and
mm.
learn about something that's going on, in this case, related to your diabetes. We
Oh,
use very simple metaphors.
mm,
For example, in diabetes, we use an example where insulin works like a key to open up cells to allow sugar in to give them.
oh, yeah.
And
I never understand like insulin and what's the counter one. Insulin and there's another thing that is
glucose,
counterbalance. Yeah.
glucose.
Yeah, probably. Yeah, I never understand what's that. Yeah.
You'll have to try our
Yeah, I
so
wanna
that's
try it.
exactly
I
what we
can learn
do.
something.
I'd love to. I'd love to. So you actually go inside your body. You
Wow.
see one of your cells. You see insulin that
Mm,
works like a key.
wow.
You actually can grasp the key. You open the cell and
Yeah.
you allow the glucose or the sugar to go in.
Wow, that's
You can then
amazing.
see with diabetes how the key doesn't work. That's
Hmm.
type 2 diabetes.
Oh, wow. That's so
So
clear.
now you
Wow.
know. Now you
Yeah.
know.
Hmm.
And in type 1 diabetes, you don't have any keys.
Oh, wow.
So
So you need keys.
you need keys. You need keys. That's why you get an insulin injection. So that's exactly what we're doing. Oh, you see, and then we have a whole suite of modules. What happens? What happens when you eat food that has a lot of carbohydrates in it?
Yeah.
You get too much glucose. And
Oh,
oh, what happens when you exercise? You decrease the amount of glucose in there. We're also
oh.
developing modules around medications. So those are just some examples of the things that we're developing, that we've developed and that we're developing. So we'll be releasing and launching our first
Hmm.
suite of modules for diabetes patient education later in a little bit later this year in probably sometime around late March.
Wow, I think this is really, really helpful because when you mentioned that, I can tell you that I have no idea what insulin means, but I know that people with diabetes, they have to inject like a super thin needle and they have to do on their stomach. Yeah, every once in a while. And then now when you say that, it's so clear. And I think this need to be like this game need to be applied to every hospital or need to be passed or every diabetes or people who want to prevent it need to play it just like how long is the experience?
Like 3.5 minutes long.
What? I can tell you I have no idea what's that, but when you mention it, just like within 3 sentences, I understand totally. So yeah, I think this is like a gossip, right? I think this everybody needs to try the HouseCall VR app.
Well, I certainly hope so. And diabetes is just the beginning.
Wow.
What we foresee is a completely different way
Mm.
for people to understand their health. Imagine you go into the doctor's office and you're diagnosed with high blood pressure.
Oh,
And instead of the doctor giving you a brochure on high blood pressure, you put on a headset and you go inside your artery and you see what it is. And you,
yeah.
and then you're given a prescription for a medication and you go to the pharmacy and instead of sticking your arm in the high blood pressure machine and seeing what your blood pressure is and looking at magazines or your phone, you put on a
Oh,
headset and you go inside your body and you see how that medicine works.
oh,
So
wow. This is
that's
like a
in
amazing.
simple
Yeah.
terms, that's easily understandable, that's short learning, that's available. And the other thing that we're doing, Dominique, is that
Mm,
we're developing a smartphone app
mm.
for people to be able to access that same information from home
Oh,
afterwards, so
wow.
that it
That's
doesn't
amazing.
just live in the headset in the
Mm,
doctor's office.
mm.
That's where the immersive experience happens. But
Yeah.
they can go home and they can show their family, they can show caregivers, other health stakeholders, people who help take care of them, people who help them take their medicine. They can show them, oh, look what I learned. And look what
Mm,
I saw, and look what I did today. Look what I
yeah.
experienced today in my doctor's office. And now this
Mm,
like makes sense. And there's that extra understanding from standing there. The thing that you and I understand when we talk about immersive experiences
mm,
versus two-dimensional experiences
yeah.
versus just the distance. And one of the ways that we really capitalize on that is to start all of our experiences when
Mm,
the patient, anyone puts on one of our headsets
mm.
to start the experience, you actually touch your body with your hands
Oh,
to signify going inside of yourself.
oh,
This is
wow.
about
Mm,
going inside of you and not seeing something else from somewhere else. This is about you and connecting with yourself and seeing
mm.
from inside what is happening inside of you.
Yeah, I think this is like an amazing like a experience, and I think a lot of patients, including me myself, will get huge benefit just by every time when I visit the doctor, and if there's any instead of giving prescription only, go to pharmacy get the medicine without knowing why. I can get a prescription of, for example, like a house call VR, some games, right? Check mark.
Yep.
And I need to do this, and then it's like a both. Between like for example, sometimes we get medicine, but because we don't know why, so we keep fall into the pitfall, which means that we didn't take care of ourselves. So I think by understanding, for example, if you said that, oh, don't eat too much sugar, right? Why? Yeah, I mean, diabetes, if the cells cannot absorb sugar, then we eat more sugar, then just force the cell to absorb. Why not? But you mentioned there's no key.
There's no
Like
key.
sugar cannot get in. Yeah, so
There you go. There you go. And you know that there's actually there's so it's interesting. There's not a lot of empirical data, so like scientific research around
Hmm.
this, but there
Oh.
is some.
Hmm.
And one of the places where there is that, so in 2017, a researcher at Cedars-Sinai Hospital
Hmm.
in Los Angeles, Omer Liren, they did a study where they did some, so they created a VR experience for
Hmm.
patients who have HIV, where they
Oh.
saw inside of their bodies what happened when they didn't take their medication.
Oh.
And they looked at some biomarkers. So they looked
Hmm.
at their viral load, like how much virus they had, and their CD4 cells. So these two markers as to whether or not they take their medication.
Hmm.
And they looked at it before they had this experience and after, and they saw a significant increase.
Hmm.
So the people who watched this video, this had this 3D experience
Hmm.
that showed them what happens inside their body when they don't take their medication, when they do take it and when they don't take it,
Hmm.
were more compliant with their medication than before.
Wow.
So, that again, this is the beginning of research, but
Yeah.
it does show that there is an impact,
Yeah.
that there is potential for this.
Yeah.
And there's other research. There was some research in the Czech Republic that was published last year
Hmm.
around educating people around hypertension,
Hmm.
using VR around
Hmm.
that. So, and that showed some really interesting results. One of the really interesting results there is that the most impact
Hmm.
was in older women.
Oh.
That
Hmm.
was really, I thought that was really interesting because I think
Yeah.
we sometimes think of XR as, being applied for younger populations.
Yeah.
But it was interesting to see that in this case, that older populations were more profoundly affected than
Hmm.
younger populations. So
Interesting.
I thought that was just a really interesting finding.
Hmm.
I'm not surprised
Hmm.
because, of course, I work with older populations and they think VR is very cool, and I totally see that. But like I thought it was really cool to see that like in scientific research and in empirical work.
Why do you think old women would like to do that instead of old men? I don't know why old
I
woman.
don't
It's just
know.
amazing.
I don't know. And and I'd have to go back and look at the study because I'm trying to remember if they made any, I offhand I'm trying to remember if they made any suppositions to what that was, why that is. I don't know. I think that's interesting. That's the beauty of science, is
Yeah,
someone should
right.
go and figure that out.
Yeah.
That's a great, I hope that they're working on figuring out why that was. I don't know.
Maybe women empathize more, and when you get old, you emphasize more and more. I don't know.
I don't know. I mean, I
Yeah.
think that's the beauty of science,
Hmm.
is that you answer one question
Hmm.
and you come up with like three more. And so,
Wow. Wow.
that's the re and why through one of our collaborations, we're collaborating. I mentioned that we're creating some content around medications and medication adherence. So like, someone gets a new prescription for a medication, they can use it in a pharmacy. We're
Hmm.
collaborating with the University of Georgia, the College of Pharmacy,
Hmm.
and we're very interested in, doing some research there, and whether it's with that university or elsewhere, looking at actually validating, can HouseCall VR really make a difference, and in doing that in a scientific way, and that's, I'm a scientist first, so
Hmm.
looking at this from the scientific lens is really important to me, to make sure that it is, having the impact that we want and making sure that we're thoughtful about that and having the impact that we want.
Yeah, wow, this is like a very big goal, and I think it will be beneficial to a lot of patients. And are there any studies, pilot program, or significant data points you've come across that highlight the successful outcomes of VR-based patient education? For example, you mentioned that you start putting the headset to your patient, especially the older generation. And does there anyone that after this, and for example, any study group that shows any significant result? For example, the person just suddenly, you mentioned that suddenly knows for the diabetes, and is there any other successful scenarios that people just maybe become better or some indicators?
Yeah, so a lot of indicators. So I'll tell you for two of the studies that I mentioned from other use cases, the Liren study and the Czech study around hypertension. And those are some of the more recent studies that have been done around VR patient education. Specifically around what HouseCall VR is working on, we're working towards that. Now, what we have done is we're lucky enough to be in a collaborative agreement. So we're collaborating with the University of Georgia, the College of Pharmacy, to create this content for use in pharmacies. Another collaboration of ours that has been just so incredible has been with the VA.
Mm,
Now, those of you in the XR community in healthcare and XR for sure know this, but maybe some of you might not know this. But the VA, the Veterans Administration, the Veterans Health Administration, it's the largest consolidated health system in the world, and it is the largest user of medical XR in the world.
wow.
So they're a leader, a world leader, the VA. And they have an entire immersive technology team
Mm,
that is outstanding. They've been champions of this technology for a very long time and have implemented this all over the country. I mean, their statistics, I'm probably going to misquote, but there's thousands of headsets being used in hundreds of places. So the VA is really a leader. I would encourage anyone who's listening, if you're in healthcare and XR, if you're not engaging with the VA, you should be. They're doing really, really incredible, terrific work.
oh,
So
the VA is that
that's the Veterans Administration. So it is
veteran.
the administrator of the healthcare in the United States for all
Oh,
veterans. And
oh,
it's a tremendous organization doing incredible work
mm,
in all 50 states and all the U.S. territories. They're serving those who served. It's really it's an incredible organization, and the people that work there are really incredible. But hats off to everyone who works there. It's really wonderful. So we've had the opportunity to collaborate with the VA through a program called the Greenhouse Initiative. So the Greenhouse Initiative is a product development initiative. And what that's allowed us to do through this cooperative agreement with the VA is it's allowed us, as we've developed our HouseCall VR, this first product, we've been able to actually refine our product
mm,
with the input
mm,
of VA clinicians, so
oh,
clinical staff and veterans.
mm,
And so that's allowed us to do, we were able to do a lot of discovery, like really digging in, like where are your problems, like where are the problem points, where are the pain points, what's hard for you? Because I know what's hard, Dominique, in my clinic, but I don't know what's hard in their clinic, and I don't know what's
yeah,
hard in
right,
their clinic.
yeah.
And then, we with our first draft of our modules, we actually were able to take these to various sites and to test our product and then refine our product based on the feedback that we got from
Hmm.
them. And so that was an amazing, it's been an amazing program. We were able to leverage 6 different VA sites
Mm.
all across the country, all the way from Georgia, South Carolina, Florida, Mississippi, Alabama to Wyoming. So really got a variety of different places, and that's been amazing. And the feedback has been great. The feedback that we've gotten has been really tremendous, incredibly encouraging.
Mm.
And the primarily the feedback that we're getting is yes, and we want more. So what else
Oh,
can you do? Build more, and we're working on doing more of that.
wow, wow. I think this is so meaningful because yeah, like a VA healthcare and also like a pretty much we can see HouseCall VR is really taking care of people of all kinds. Yeah, and I think yeah, I mean right now, as far as I know, the mental health or like any parts of like our healthcare, especially for younger generation, that is like a very crucial. So I think yeah, like I think HouseCall VR is doing very well. Cool.
Thank you. Yeah, it's been an interesting thing, going from being a um, just practicing medicine to starting a technology startup. It's definitely a different thing.
Cool. Yeah. And looking ahead, how do you see immersive technology evolving in the healthcare sector over the potentially next 5 to 10 years? I know future is unpredictable. Even this year, when Jensen
Yeah.
Huang mentioned that this year will be an agentic AI, which means that AI not only limited to chatbot, but also becomes potentially human form and do things for you or like a eliminate a lot of SaaS software. So what do you see? I cannot predict at the end of this year, but I know you are the expert in the healthcare and also immersive technology sector. What do you predict in the future?
Yeah, I mean, I think that's such a hard question, Dominique. I mean, it's hard to say. And healthcare is one of those industries that is so painfully slow to change.
Yeah,
You
same as
know,
education.
yes, yes, yes. I mean, I think about I have a junior in high school, and his school absolutely bans Chat GPT.
Wow.
And
And
I
how
just
about
think
phone? No.
that they haven't banned the phone yet, but I think
Oh,
they will. And you're just burying your head in the sand. Teach the kids how to use the technology.
yes,
You
yes.
can't just, but anyway,
Ban
I mean that's,
everything.
you can just ban things and
Mm,
run away. I mean, I guess they're just buying time, but it's the fundamental shift that is coming,
mm.
I think is difficult for really anyone to say,
Yeah.
say. What I
Yeah.
will say though
Mm,
is that we are from an immersive technology perspective, and this transcends healthcare.
mm, mm,
We are on the cusp of changing the way that we interact with technology.
mm.
We and I would say even information. So and if you think of that as, I know it's right now, like AI is yes, and I agree, transformational, but if you look at it through this lens, you might agree with me that immersive technology may have an equal impact.
Mm.
Humans started communicating with each other through language, right?
Yeah.
Spoken
Yeah.
language, right? And that was needed to be real time, right? Like I would tell you a story, and
Mm,
then maybe you would tell someone else a story, but there's
mm,
obvious problems with that.
mm,
And so then we started using two-dimensional representations, right?
mm,
I would draw a picture on a cave,
mm,
right?
mm,
Don't don't go behind the rock. There's a tiger behind the rock, right?
Yeah, right.
And then you would know that. And then anyone who saw that would know that. So it would transcend time, it would transcend space. We didn't need to be there.
Mm,
So, but it was a two-dimensional representation and a two-dimensional understanding.
mm,
And really, truly, we're still communicating with each other through
mm.
two-dimensional means. So you
Oh,
and I now are
mm,
still communicating through two-dimensional means.
yes.
And we haven't solved the ability to communicate with each other through three-dimensional means.
Oh,
And
mm,
immersive technology
mm.
is that next leap. It is the
Oh,
next leap in how humans communicate. We will transcend
mm,
the ability to just communicate in two dimensions, and we
mm,
will move into communicating with each other and interacting with technology and interacting as a species from two dimensions to three dimensions. And that's a fundamental shift.
mm. Wow. So, I heard I haven't been to CES this year, but I saw a lot of posts. It seems like CES this year is all about smart AI AR glass, right? So, just like echoing what you said, that you believe that right now we are fully use like a 2D. We are very master in using 2D form of communication, and the next level will be 3D form. And how can we see each other in the 3D form through maybe a smart glass? And also, how can we interact in a spatial types of things, right? Like immerse ourselves into a space where all the virtual and potentially physical things are merging together. Yeah, it feels like a sci-fi.
Yeah, yeah. And not just people, but information. No,
Yeah.
words on paper
Mm,
are really, an email is just words on paper, really.
yes. Yes.
It's
Yes.
just a fancier way of delivering the words on paper,
Yeah.
but it is still words on a paper.
Yeah.
And it is still information. A video is still a flat two-dimensional representation of something.
Yes.
And so we're
Yes.
moving now into a time when that information
Hmm.
can now be represented in a three-dimensional space. And
Wow.
that's, frankly, that's what we're working on.
Hmm.
That's what anyone who's working
Hmm.
on meaningful work in
Hmm.
immersive technology is working on. How do we translate what's in 2D into 3D? And that's everything. So, and just to go back down from the larger conversation to the smaller conversation, every module we make,
Hmm.
we have a rubric, right? Like we have our curriculum, like what's the limiting belief? What are we trying to say? What's the metaphor? Whatever.
Hmm.
And everything we do, we have to justify why VR.
Hmm. Yes. YVR.
Why VR? Why can't why is this better than a video?
Yeah.
Everything we do. And it
Yeah.
has to be justified.
Yeah.
And how is this, like, why are we using this medium? And how can we use this medium in a meaningful, impactful way to transmit the information? So
Yeah.
it's not words on a page. We're
Yeah.
we're moving beyond that. So that's what I see. And that's so exciting. And yes, using AI as the fuel for that
Hmm.
is exciting, but the real transcendence
Hmm.
is the new way of sharing and interacting with information.
Mm, yeah, I think what you say is, I think it's also the future because you see, like we are migrating from fall. Later on, slowly we will become migrate to glass. Have you tried Ray-Ban? Ray-Ban, the
You got the
smart AR.
Ray-Bans?
Yeah,
Yeah.
I mean, yeah, right now, I mean, actually, yeah, I mean, I work for Meta at this moment. So I mean, yeah, like you see it every day. Yeah. So what do you see? Like for example, have you tried any like AR class? And you find out that it might be potentially next like a big hit or something? Like, what do you
Ah,
foresee a device that can really help HouseCall VR to, do the next, for example, like the
yeah.
information?
So yeah, good question. Good question. We're really wed now to VR because we're telling stories,
Oh,
right now.
yeah.
Now, of course, there will be a time
Mm,
when we want to overlay, we want
the
to
real.
leverage AR, right? Where we want to teach people how to grocery shop for health, where we want to show them how to
Oh,
give an injection, where we
mm,
want to, teach them how to draw up a medication. And of
mm,
course, all of
mm,
that procedural knowledge.
mm,
Currently, we're still in the story time piece of that. I see a convergence of
mm,
all of these.
mm,
I've heard I've heard some really interesting thoughts on, the idea that the AR glasses will be more like our phone and the VR
mm.
glasses will be more like our laptop, like and that's not mine. I don't know who said that, but somewhere along the way, I think I can see that, being more, one is a little more higher processing power. That's TBD. There's a road to go. We're
Mm,
still in the infancy. People will look back and laugh at the computers we strap to our faces currently. It's
yeah,
ridiculous. Of course it is.
yeah.
But that's where we are now.
Mm,
I have no doubt that we'll transcend this
mm.
to the technology is is speeding up and Meta and ByteDance and Google and like all of Apple, all of these companies, of course, are betting on this because I think they understand that fundamental shift is coming. Who's going to do it in what way and on what platform? I still, yeah, TBD. I don't know.
Wow. Yeah. So, I mean, I think VR is a great source to do storytelling. And I think I can see why you want to use VR as a main media because I personally I have patient project that I did it like after work or weekend. I turned literature into like a immersive experience. I was trying to do more like AR. I was doing like a swifting. I was trying to see what's the difference. I think a VR does serve more. For example, the first work that I did, I turned Edgar Allan Poe the Raven into the VR experience. I was trying
Oh,
to make
wow.
it AR, but AR, you see, like you need to be in that,
Yeah.
Victorian style of
Yeah.
house, and there's dark and there's a raven on the window. If that's say in my room and my dog and cat is running around, and like it doesn't feel that scary anymore. So yeah, I do see like a why VR totally put you inside a
Yeah.
totally different, teleport you to a different space versus you are still in your space and some additional stuff augmented on top of your reality. That serves a very different, I would say,
Yeah.
perspective or like cognitively. It feels different. So I do appreciate you mentioned that VR for storytelling is still the best media so far.
Totally. Absolutely.
Yeah, and another question, how can students, resident, or early career healthcare professionals, or either, because I know the HouseCall VR is in the sector between professional Medicare and development, right? So for XReality, we have or our audience are more XR people, right? So, how do you see, for example, what's your advice for healthcare professionals who wants to do storytelling in VR and help a lot of patients? And also, to our group, it's a lot of like XR developers, and you know that tech right now for some reason massive layoff is like Hunger Game right now, right?
Yeah.
Right? It's like performance driven. So there will be like tons of XR people being released. I usually said graduate from the companies or being released. How do you see the huge kind of like a power that shifts to the area that really help contribute like a healthcare industry. What's the advice for you to both of the group?
Well, I hear you. I think there's a lot of challenges. It's a tough time, but an exciting time, right? You have to
Yeah.
be, I think you have to be a believer.
Mm,
You have to be a believer. This is not like a bandwagon time. You've got to really truly believe in this to
mm,
be here. I mean, the work that you're doing is so, so incredibly important because this is like, we've got to just stick in there. It's the people who are making the content, who are making the killer app. I think that's I think that's what we're all sort of waiting for, right? We're all
mm,
sort of waiting for what is going to be the one big, real sort of overly popular killer app that everybody can't live without, and then that
mm.
really changes things. I don't know if that there's going to be one.
Yeah.
I don't know if there's going to be one. Is it going to be a group? Is it going to be, yeah, I don't know if it's going to be just one. I suspect that it's going to be several
Mm,
across different verticals
mm,
that makes things work. I do see a tide of many of these, smaller companies like myself,
mm,
like, in the healthcare vertical, really, working very diligently to prove our worth and
mm,
to make a difference in education,
mm,
in simulation and
mm,
training,
mm,
at large corporations, really doing the hard work of creating that. Um, for people that are coming out and who are interested in learning more
mm,
about the healthcare vertical in particular,
mm,
there are, LinkedIn is, obviously a fantastic place to
mm,
go. I would
mm,
say find people, connect with me, message me, let me know, I'm happy to message with people. There are organizations like IVRA, International Virtual Reality and Healthcare Association, that does some amazing work, has a great conference. There's a conference at Cedars-Sinai Hospital called VMed that's happening in June.
mm,
And then Augmented World Expo that's happening in Long Beach, California, also in June.
mm.
Um, we'll be there. You can come see HouseCall VR.
Oh, yeah.
See it.
I think yeah. I mean, I probably will go this year. So yeah, I will definitely check out the booth.
Yeah, we'll be IVRA, the International Virtual Reality and Healthcare Association, has a pavilion there. And
Mm,
so we'll have a booth at the pavilion there. So you can stop by, anyone who's coming by can stop by. But like I said, LinkedIn is a great place. Follow
yeah.
the people who are talking about meaningful things for you.
Yeah.
And although it can get really overwhelming, sometimes I go on and I'm like,
Yeah.
oh my gosh, I'm missing out. But I think all social media is like that. You feel
Yeah.
like, it can be a little overwhelming, but most people I find are really open to connecting and to
Yeah.
conversations. And, I think that's a great place to go. And like I said, in live conferences,
Mm,
the VR AR Association is
mm,
another organization that has a lot of, every year they have a healthcare summit. They do other verticals. They have, I think, a defense summit, an education summit, and
mm,
and getting involved with them is a really great way. So a lot of organizations coalescing around immersive technology that I think are really worthwhile. I'm sure there's
mm.
others that I'm forgetting, and I'm sorry if I'm forgetting others.
No worries, no worries. I mean, I think all those are pretty big. AR, IVRA, right? IVRA. The one
IVRA, so
Vivar.
IVRHA
Oh,
and
IV.
IVRHA,
Yeah, and
and the
then
other is the
ARVRA.
VRARA.
Yeah, that one is like a VRARA, ARVRA.
I know. Yeah, yeah. The VR is first. I always like to remind them of that.
Yeah, in LinkedIn. Yeah, I learn a lot of like a news every day. I when I wake up, I just open my LinkedIn, and it's all about the most current things. I find out my LinkedIn is my news source.
Yes, yes, yeah. I love learning about all the things. There's like some really cool companies doing incredible things that
Yes.
that I always like to see. And I'm always excited because the founders, and these are like pretty big companies, they're really willing to connect with startup founders like myself. So I always think that's really cool.
Yeah.
And I love that there's like a community like that. So
Yeah.
and for anyone that's listening to the podcast, feel free to reach out to me. Either like through my LinkedIn is probably the best way to do it. Or, through HouseCall VR, there's a get in contact there. And of course, if you're in a hospital and you're interested in deploying our first product, the diabetes patient education modules, feel free to reach out to me and we'd be happy to talk to you about deploying that.
Wow, that's amazing. And at the end, do you have any like thoughts or advice or any point you want to address that we didn't mention during our talk? And any last like a talk you wanna or like things you wanna mention?
Well, first of all, thank you, Dominique. I really appreciate the opportunity to come on and to talk about, this crazy passion that I have about, using immersive technology. And yeah, I'm actually I'm at a podiatry conference right now, and
Wow.
I'm going to be speaking tomorrow on innovation, and it's awesome to be a, a healthcare provider.
Mm,
It's an honor to serve patients, and to now to be able to build something that can help people, fundamentally, they could potentially fundamentally change the way
mm.
people understand their own health and
Oh,
really change outcomes.
yeah.
And while I'm doing that, to also help doctors work faster and better and more efficiently,
Mm.
that's our goal. And
Oh,
so
mm.
when we work on that, and when my patient comes out, takes the headset off, and they say, wow, I really understand that. That makes perfect sense to me. And
Oh,
I'm able to, breeze through my day, and I don't have to repeat the same thing over and over again. It's like a win-win. And
yeah.
so it's been, as long as I can keep doing that, this is, it's a real pleasure and an honor. And I really appreciate the opportunity to be on this podcast, and, and share a little bit about what I'm doing to be in the company of the other people that you've had on the podcast. Thank you very much.
Thank you so much. Yeah, I learned a lot from you, and I understand that wow by HouseCall VR the program. I understand like just by what you describe. I think I understand like diabetes and sugar, and also like insulin as a key, right? I feel like wow, this is so visualized and it's just so simple and without like a lot of data and a lot of like words that I have to keep googling. I find out this makes perfect sense for people, like people, the public who hasn't really learned anything about medical, like me, myself. It will benefit all of us. Yeah. So thank you so much for doing such a meaningful work and benefit the entire area.
Thank you so much, Dominique. I really appreciate the opportunity to be on your podcast.
Cool. That's it for this episode. Thank you for listening. We release episodes weekly. If you enjoyed this conversation, check out our other episodes on Spotify, Apple Podcasts, or YouTube. Support us by giving us a follow and a 5-star rating, or subscribe to our channel and give this video a like. Thank you, and I will see you